Yeah, always hard to say what carries over how much between mice and humans. But that being said, as we'll discuss a bit more, it has a pretty reasonable safety profile from a pretty high amount of human trials. As we mentioned, this is FDA approved on a different indication. And for an individual that needs to delay ovarian aging for whatever reason, it's something that they consider as part of the regimen.
Talking about some of the up and coming things. So this one that sort of caught my eye was a very simple study design. They're looking at delaying ovarian aging. I think this again goes back to some mice studies, and mice, I don't believe, go through a true menopause. There's a similar phenomenon, but not exactly. But basically they're going to give women a once per week dose, 5 milligrams of rapamycin. And then they're going to measure the AMH levels and see if those are maybe increasing or declining more slowly compared to, I presume, a placebo group or a reference population, which will be interesting. I would be more interested in an individualized dosing protocol than sort of a set milligram dosing. But again, that does make the study more expensive and more complicated and less likely to get funded, I would assume.
Yeah, that being said, you could probably give mice PCOS, and that would also increase their AMH. AMH, the lower it is, in general, the less eggs you have in your ovary, and the higher it is, the more eggs you have in your ovary. If you have PCOS, it does tend to run higher. More follicles, more AMH production.
And it actually translates to a longer reproductive window. So it's not just sort of an artifact of the syndrome. It's something that actually seems to extend reproduction. But again, PCOS could be a challenge for someone's health span because insulin resistance does tend to go along with that.
Yep. So yeah, always hard to say what carries over how much between mice and humans. But that being said, as we'll discuss a bit more, it has a pretty reasonable safety profile from a pretty high amount of human trials. As we mentioned, this is FDA approved on a different indication. And for an individual that needs to delay ovarian aging for whatever reason, it's something that they consider as part of the regimen.
Yeah, absolutely. And while we're under this sort of umbrella of reproduction, this one was really interesting. I think what they did was they incubated these oocytes being used for like potential future in vitro fertilization with rapamycin. And the take home was that it suggested that the maturation rate was increased, so more oocytes making it to maturation, more viable oocytes, and improve their developmental potential and reduce the accumulation of DNA damage. So DNA damage is another sort of hallmark of aging, you can call it. So I thought this was a really interesting study because it's actually, you would think that a cell's very first cell would not be overactivated, but then you go and look at I guess I could use the word host or the female in that picture.
Yeah.
If that person has excess mTOR signaling, then it does seem kind of intuitive that these cells derived from that individual would also potentially have some excess mTOR signaling.
Yeah. Perhaps could stack nicely for those on fertility protocols that include growth hormone or growth hormone releasing peptides. Because it is pretty commonly used off-label, not necessarily like academic centers. But HGH is certainly used in fertility protocols. So that could be some nice synergy. And then another thing that I just thought of, perhaps it could be useful for males that have high amounts of DNA fragmentation. Because fragmentation, especially as age increases in the male, is a concern. If fragmentation is 50, 60%, that's a huge concern. But that would be, I don't think there'd be any evidence for that, but it could be a benefit.
I think there's some evidence to the counterpoint of that. I don't know if I put the citation in here, but under side effects, at least in mice, it's shown that mTORC1, which is the preferential target that rapamycin is going to hit, does seem to impede spermatogenesis, at least in some amount of rodents, some strains of mice. So, do we know if this is happening in humans? Not necessarily, but again, it probably depends on the baseline level of signaling.
Yep.
If you're just restoring a normal, then I think absolutely, to your point, that putting things back to a more optimal state would lead to a better quality of sperm being produced, just like we see a better quality of egg here.
Yeah. Also, if you go from a count of 150 million to 120 million, but you have significantly less fragmentation, that would be
quality over quantity.
Yeah, quality over quantity. We already do that with morphology and motility, so kind of makes sense. Anyway, that was a nice little rabbit trail.